Today we are going to talk about psychoanalysis and its scope in India. With me is Mr. Pulkit Sharma. Can you please introduce yourself?
Hi Akash. I am final year M.Phil trainee in clinical psychology at IPAS, India, and I'm completing my M.Phil training to become a clinical psychologist. And I would say that I'm also a student of psychoanalysis, someone who has a great interest and passion for psychoanalysis, and
Right.
especially Indian psychoanalysis.
Okay. So if we get down to the brass tacks, aspiring psychology student who wants to become a psychoanalyst, is there any scope in India for them?
Well, psychoanalysis has a very great and especially a very deep scope in India
Mhm.
and more or less everywhere in the world. As we would see that there's a transition where people are very tired of how there are very fixed therapeutic modalities, especially cognitive behavioral interventions, and you would see how clients would ask for more
Mm.
detailed, deeper meaning towards not just about their psychopathology, but also about the way they are
Yeah.
and the way they are being. And somewhere psychoanalysis offers that insight. And it isn't just on an intellectual level, rather,
Mhm.
it's also on an emotional level where one person would know, okay, this is how I am, this is how I've been. And if there is a pattern which I am struggling with, maybe I should do it differently. So,
Right.
psychoanalysis offers us this space where we get to know about ourselves, about our families, about people we have been with, and everything else.
And the student also has to get through their own psychoanalysis.
Yes, certainly. I think when it comes to the training to become a psychoanalyst, that's a very different domain altogether
Mhm.
because one is that you have to be in analysis, you have to be under the supervision, you also
Mhm.
have to read a lot of psychoanalytic literature, and
Mhm.
also have to work clinically. So that is a different game altogether. And if one is interested in becoming a psychoanalyst or let's say a psychoanalytic informed therapist, then
Mhm.
in India, two organization. One is PTRC, which is in Mumbai, which
Mhm.
offers training and supervision to therapists. And then there is Indian Psychoanalytic Society, which is in Calcutta, India. So these are two organizations a student, a therapist can go and get trained in psychoanalysis.
Right. What are some of the misconceptions that people have about psychoanalysis?
Mm, I believe one misconception that people have about psychoanalysis is that it doesn't do anything.
Mm.
It just offers you an insight. It doesn't promise you any behavioral change, any kind of reduction in
Mm.
terms of the symptoms that a client or a patient might be experiencing,
Mhm.
which is not at all true. Rather, the psychoanalysis doesn't just focus on symptom reduction, but why is there even a symptom? Now, what is the meaning behind that symptom? And if there is a symptom, and if we have gotten rid of that symptom, how should a person have a more healthy, have a more fulfilling sense of life? So,
Mm.
this is what psychoanalysis also offers. What if there is an injury, but that injury is internal? And yes, we have certain interventions which offers a fix, which offers a
Mhm.
band-aid. But if the bleeding is internal, psychoanalysis explores on that. It explores the unconscious which is something which govern our behavior, our actions, the way we are, the way we feel, the way we react, the way we respond to. And it's only through psychoanalysis where we get comfortable with the idea of how we are.
So, would you say that all of Freud's theories are correct, or are you more inclined towards neo Freudian theories?
The thing is that now, what does it mean to be correct or incorrect? Because if you would see the cognitive behavioral interventions, we would see that they are evidence-based. Well, so is psychoanalysis. One has to read. So if one has to read, they have to read Jonathan Chetler's article on the efficacy of psychodynamic therapy. But coming back to the misconception, I think a lot of people also believe that it's very outdated because, again, as if you're just fixated on Freud. Now, Freud is extremely essential to learn psychoanalysis. But it isn't just Freud, it's also Melanie Klein, Winnicott, and Nancy McWilliams is also there. And then there are so many contemporary psychoanalysts, for example, Salman Akhtar is there, and many others who have contributed immensely to the field and to the development of our understanding of what psychoanalysis is. The thing is that people are also very confused about what is psychoanalysis. It is something which is a modality, a therapeutic modality. It is a theory to explain human mind. It can be used in literature. It can also be used in understanding art. Now, when we speak of psychoanalysis clinically, then it is a theory which gives birth to practices and techniques which elevate and lessen the human suffering.
So, suppose someone is a CBT practitioner, can they integrate psychoanalysis as an eclectic approach, some of the techniques?
So, one can always be psychodynamically or psychoanalytically informed. And when we speak of cognitive behavioral intervention, we tend to focus on cognitive restructuring, cognitive distortions, and how the cognition and the emotions are associated with each other. Yes. But at the same time, when we are also implying and perhaps employing the techniques that are there in CBT, how are we approaching the patient? How are we also understanding the inner world that they're coming with? They're not just coming with their symptoms alone, but they're also coming with their childhood, with their desires, with their sexuality. So what about that? And for that, we need to have this orientation in mind to know and to perhaps offer a more fulfilling sense of being.
And do you believe that in other therapeutic approaches, also a student should undergo the necessary therapy that they want to give to others?
I think me individually, I believe, especially psychology students and students who are interested in providing psychotherapy should be in psychotherapy and not necessarily psychodynamic or psychoanalytic. They can also be under cognitive behavioral, emotion-focused therapy, and then many other therapeutic modalities. But it's better to have an understanding of how we are.
Right, of course.
To have a more complete or perhaps a more good enough understanding so that we would be able to understand others. Oftentimes, when we are not in therapy, we are not able to understand someone else's perspective, and that creates a trouble. And sometimes, even when we are speaking of CBT or when we are speaking of other modalities, we're not able to understand where the patient is coming from. So having that psychodynamic lens again gives us that sensitivity and that sensibility to retain, okay, this is where the patient is, this is where the client is, this is what's happening, and maybe I shouldn't do this, maybe I shouldn't use this technique, and maybe I should just do something else.
Is it a practice that one can start on their own, or are there institutions that you have to be attached to practice?
Okay, so when we speak of psychodynamic psychotherapist, one is to be under supervision of a senior psychoanalyst or senior psychodynamic psychotherapist, and supervision is extremely essential. One can't do psychoanalysis all by themselves, and even if they're engaging in self-analysis, there will always be blind spots. And that this is something which is also applicable to other psychotherapeutic modalities. But if one is interested in becoming a psychodynamic psychotherapist, then they have to be under supervision. They also have to be reading, getting themselves exposed to multiple books, and not just to book, but also to psychodynamic spaces. And if one is really interested and one is more passionate about becoming a psychoanalyst, then there are two institute centers in India, particularly PTYC and Indian Psychoanalytic Society, IPS in Calcutta, and these two offer training in psychoanalysis. But before the psychoanalysis and before the training, one has to be under analysis. One has to know where they are coming from, what's their fantasy like, what's their dream like, and of course, what are they like?
Right.
The couch doesn't make us a better person, but it certainly tests us whether we are human enough or not. And this is something which a professor has taught me.
Okay. Okay. So the last question I have for you is if some student wants guidance or mentorship from you regarding psychoanalysis and the journey of a student, how can they contact you?
Well, they can reach me out on LinkedIn, and since we would post that video, so I would also mention my contact details, and they can reach me out. They can ask for help, or they can just ask for guidance. But if someone is interested in psychoanalysis, then they should also start reading. And when I speak of reading, it doesn't just mean reading Freud. Freud is necessary. It is extremely essential to read Freud's literature contribution, but also to have a more contemporary understanding. So I would suggest reading Nancy McWilliams' Psychoanalytic Case Formulations, Psychoanalytic Diagnosis, Psychoanalytic Psychotherapy. Then there's Alessandra Lemba's Introduction to Psychoanalytic Psychotherapy, a very brief introduction. And then to just delve into which school of thought they resonate more with or they identify more with, and then reading those clinical thinkers. So for me personally, I would suggest reading Winnicott, reading Salman Akhtar, and reading Melanie Klein. And then there's, when we speak of Freudians, then there's Anna Freud, there's Sandra Ferenczi, and of course, Freud.
Thank you so much, Pulkit. You have been really insightful, and I hope people have gained some insight. It was really nice to have you on the platform.
Thank you, Akash. Thank you for having me, and thank you for this wonderful opportunity to make psychoanalysis accessible, and yes, accessible to psychology students.
It's a pleasure. Thank you so much.